some housekeeping with you. First of all, we're all presenting from our homes this evening. So if you do hear any screaming children, any dogs barking, please excuse us for that. It is common practice on Zoom these days to have these distractions. Second of all, throughout the presentation, you're probably going to have questions that you want to ask. We're going to address these at the end of the presentation. So if you pop your questions in the Q&A or the chat function, which at the bottom of your screen, we'll aim to answer them at the end of the presentation. Tonight's presentation, as you know, is about coping with stress and anxiety, whilst also fostering connections. As parents, all of us are sometimes struggling in these times to deal with maybe our own child who is going through difficulties. But as teachers also, we're noticing in students and the young people that we care and love about so much, we're seeing different stresses, different anxieties appear, and certainly different mental health concerns appearing. And tonight we are delighted to welcome two guests to the school. And first of all, I'm going to introduce Dr. Mario Cappelli. He is a long-time friend of Elmwood. He is a child clinical psychologist who for the past 25 years has specialized in working with children, youth, young adults and their families. He is currently the senior clinician scientist at the Ontario Centre of Excellence for Child and Youth Mental Health and an adjunct professor of psychology and psychiatry at the University of Ottawa. Dr. Cappelli provides clinical services at Cappelli and Associates. And a big welcome to you, Dr. Cappelli. Next up, we have Stacey Segal, who is a clinical social worker who has been working in the Ottawa community with children, youth, young adults, and their families for the past 20 years. Stacey's clinical experience with children, youth, and families has been forged in a variety of settings, including the Children AIDS Society of Ottawa, Family Services Ottawa, CHIO, and currently at the Bariatric Medical Institute as a pediatric social worker in the Ministry of Health funded Family Reset Program, and in private psychotherapy practice as a senior clinical associate at Cappelli and Associates. It is my great pleasure to welcome you both to this Elmwood's virtual event. And I'm going to stop talking because you are far more valuable than I am this evening. And we want to get going with your expertise. Welcome to you both and everybody. I hope you have a great evening. Thank you.
Well, thank you, James, and really pleased to be here. And both Stacey and I were excited to hear, when we got the invitation, and hopefully we'll spend a little bit of time sharing with you some of our thoughts on how kids and young people and parents are coping. And then we want to leave a big chunk of time at the end for discussion and question and answer. And so that we can hopefully provide you a couple more tools in the toolbox to help you deal with the day-to-day stressors that we're all currently facing. I know that Dr. Gillespie gave a talk, I think it was a week or so ago, and so I'm really mindful of that, and some of the material that I'm going to be presenting tonight might overlap a little bit. I know that Stacey's, when she comes on and talks about some of the other parts of the presentation, they definitely will not overlap. I was debating whether including some of the overlap, and I chose to, just recognizing that not everyone in the that's part of this webinar or this presentation would have been there last week. So what we want to really talk about tonight is coping with stress and anxiety while fostering connections between children and parents. So for tonight's presentation, a few things that we want to hopefully get through. First of all, we want to present an overview, sort of what the mental health profile of our children and youth, what it looks like, and also what it looks like consequence of COVID-19. We also want to take a little bit of a step back and think about what the impact of COVID-19 has been on the mental health of our parents. We want to then explore some individual clinical strategies to deal and cope with mental health concerns, and then really spend the last half of the presentation looking at more attachment-based strategies to help children and youth and families, and talk a little bit of why attachment is important and how it fits in with the, with some of the other individual clinical strategies. So prior to the pandemic, this was not an unusual sight, seeing one of our adolescent kids or one of our younger kids really distressed, and lots and lots of day-to-day stressors, including stuff that they get exposed on social media, worried about conflict, body image, exams, tests, university, self-esteem, bullying. And so we recognize that, boy, these kids are bombarded with so many different expectations and different stressors. And in fact, you would see almost on a monthly basis or weekly basis, these headlines in papers, like for instance, the Toronto Star's, headline, almost half of Ontario youth miss school because of anxiety, a study says. Why are more American teenagers than ever suffering from severe anxiety? And it's the girls who suffer more. Why young women face increasing anxiety. So typical headlines. And in fact, this is a slide. It's a really busy slide, but I want to walk you through this because it's a really, really important slide as when we think about our children as they develop into adolescence, as they move into young adulthood, and as they move into adulthood. And this is a slide that basically looks at the age of onset and the age in years of, the first thing I'm going to look at is anxiety disorders, right? And so anxiety disorders is the red line. Down below on this axis is the age of the child. So whether they're 2, 4, 6, 8, 10, 34 years. And this is on this side, on this axis is the proportion of individuals that are experiencing any anxiety disorder. So when a child is 4 years old, it's about 10% of kids that are 4 years old will experience an anxiety disorder. Typically, it would be something like separation anxiety. But what's really interesting when you follow this curve or this trajectory, at around the age of 12, you start seeing some real increases in the amount of anxiety. So between the ages of 12 to roughly 18, you have an onset of anxiety in about 40% of our children and youth. So up until age 12 or so, there's been some anxiety, and then there's a sudden huge trajectory of anxiety disorder. So by the time the child is 16 or 17 years of age, 80% of the population would have experienced its first onset of an anxiety disorder. And that's a little different. If you look at substance disorders, the green, it doesn't really happen till the 20s. And similarly, even with depression, there's a slower trajectory, and it's not until later on, 2022, that you start seeing the same number of depressive episodes or depressive disorders. So not surprisingly, it's the anxiety disorders that you'll see in early adolescence, which oftentimes is really the first time that we cope with, as parents, we recognize that something's wrong with our child. We often will say, geez, things were going really well, before, when they're 8 or 9, they seem to be really happy. They never worried about anything. I don't understand why suddenly, in grade 7 and in grade 8, they're experiencing this overwhelming anxiety. In part, it's because of the normal trajectory of the disorder. So it's an important thing to keep in the back of your mind. And similarly, on this side of the presentation, or on this slide, and you can see that some disorders, some specific disorders than anxiety, have different trajectory. And the one that we most often see in our children is what's called GAD, which is the generalized anxiety disorder. And that's the green line. And if you follow this green trajectory, what you'll see is that there's generally no incidences of GAD up until the age of 12. And then suddenly between 12 and roughly 18, you get the huge slope, the huge increase in these generalized anxiety disorders. So again, reflecting what we see most commonly, generally a pretty calm, child in early childhood, things are going well. It suddenly comes adolescence, and you start seeing this overworrying, this catastrophizing, this difficulty sleeping. You start seeing all these symptoms that are typical of someone who's experiencing a generalized anxiety disorder. So the first thing we often get asked is, well, how do you know if it's stress, or how do you know if it's an anxiety? So stress can be expressed as something physical, mental, emotional. It tends to be a response to something, to an event in our environment. It can be normal. We all experience stress. It can be related to both negative and positive events. So we always think of stress being related to something bad, but a new job, a new home, even going on a holiday can be stressful. And there are some extreme forms of stress, and these are characterized as mental disorders. So, for example, post-traumatic stress disorder. Our soldiers were perfectly healthy. They off go to war, experience trauma, and come back and have PTSD. And so they would never have had this disorder had they not gone into a war zone. Anxiety, on the other hand, is a little bit different. It's characterized by much, much more excessive, persistent, and chronic, but it can also be episodic, feelings of worry or fear. And one of the big differences between anxiety and stress is that anxiety triggers can be real, but they can also be imagined. And that's what we'll often hear from our kids. They'll say something, I'm just so worried something bad's going to happen. Meanwhile, nothing bad has happened, but it's just their worry, their imagination that something awful is going to happen. And almost always anxiety leads to significant distress and significant functional impairment. So they stop enjoying the things that they enjoy. They stop enjoying their normal day-to-day activities. It affects their quality of life. It affects their appetite. It affects their sleep. It affects their studying. It affects their academic performance. But what I find most interesting with stress and anxiety is that if you take a look at the symptoms that we experience, they're the same whether it's a stress-related disorder or stress-related cause, or if it's an anxiety disorder. It's characterized by aches and pains, grinding teeth, dizziness, gut issues, increase or loss of appetite, and go either way. It could be expressed as difficulty falling asleep, or it can express as difficulty even staying asleep. There's a sense of tiredness, low energy, racing heart, sweaty palms, irritability, loss of concentration, forgetfulness, and avoidance, typically as a way of coping. So it's really hard to know and to separate, is this stress related or is this anxiety related? And in some ways, it doesn't really matter. It's not that the diagnosis is really going to change how we see the level of suffering that our kids are experiencing and how we're going to manage it. It's really about the functional impairment and how it affects, their minds, their body, their emotions. And then comes COVID, right? As if things weren't bad enough, we have this pandemic virus that hits us all, and we've all seen the impact of the virus. But I'm going to walk you through a couple studies that we just finished doing at the Center of Excellence, and there's myself and Ashley Radomski, who's one of my postdoctoral fellows, and some close colleagues of mine, and just want to acknowledge their contributions. And there's Paula Cluche, Nicole Sheridan, Christine Polaronis, Bill Gardner, Kathy Pager, and Pranima Sundar. And basically what we did, we ran two studies, and we conducted those studies just soon after the onset of the pandemic in April, and finished collecting data, the first set of data in June 2020. And we really wanted to capture what the respondents' mental health experiences were, what their service needs and preferences in relation to the pandemic. We're talking about mental health services needs here. We recruited through social media advertisements, because that's what kids are on, right? So that's where you're gonna capture them. We through post and email invitations, and this was done throughout Ontario. And participants completed a 10-minute web-based survey, both in English and French. We had over 1,300 youth and young adults between the ages of 12 and 25 complete the survey, and over 500, it's actually closer to 600 maternal parents and caregivers with a child between the ages of 4 to 25 participating. And just as an FYI, next month, we'll be launching 2 follow-up surveys to see how things have changed from the early stages of the pandemic to where things are now. So what did we find? So from the survey of the youth and young adults, nearly half reported a mental health concern that was rated as either not so good or poor. So almost half of our young people were reporting, a pretty poor mental health. Nearly 30% reported a current diagnosis that they were getting help for. 61%, nearly 2/3, reported a worsening of their mental health since the onset of COVID-19. And a third of those who report anxiety at the clinical level also reported significant impairment in their day-to-day lives. Basically, weren't able to go to school. And it was interesting because in the clinical subsample, so those with a current diagnosis, 75% reported that their mental health, had gotten worse since COVID-19. And I'm sure some of you have seen these numbers reported in the media with other surveys, but they've been fairly consistent. But when we took a look at the service part of the survey, only 30% reported that they didn't require any mental health services. Of those in the clinical population, so in other words, of those kids that we were already providing care, nearly 30% stopped accessing services at the time of COVID. And this was quite worrisome for us providers because whether we're working in a community practice, we also saw it across hospitals, we saw it in emergency departments. It was suddenly a stoppage of children and youth presenting with mental health concerns. And again, there were a number of reasons why. One was that we were told not to leave unless it was an emergency, so everyone stayed home. But the other reason too is that we created a safe place for a lot of young people. In other words, those that were anxious and distressed, well, they weren't exposed to any stressors. They weren't going to school. They weren't being exposed to bullies. They weren't being exposed to any exceptional demand. So we saw a significant drop in services. What was also really interesting that almost 100% of our youth in the survey, said that they would like to, have some services that might be helpful. A lot of them wanted online information and wellness supports. Some asking for more in-depth self-help support, and about 50% of youth asking to see someone. But what about the parents? So this was the second part, the second survey, where we looked at almost 574 essentially mothers. The average age was roughly 40 years, mostly Anglophone, a large proportion coming from the Eastern Ontario region. And the median income was $125,000 or above, so a fairly, higher SES bracket for sure. 50% of the moms or the families had 2 children. The average age of the participants in this study had kids at around 10 years of age, and 3/4 of the children were between the ages of kindergarten to grade 8. So this gave us sort of an insight also in terms of some of the of what the impact was for parents of younger kids as well. So not just the older kids. So when we looked at moms or parents, over a quarter, or roughly 30%, reported that their current mental health was not so good or poor. So teens was about 50%, parents was about 30%. About 17% actually reported anxiety at a clinical level enough to be diagnosed with a generalized anxiety disorder. And 3/4 of the mothers reported moderate to high levels of role strain and burden while caring for their child during COVID. So exceptionally strained, exceptionally burdened. And in fact, almost 15% actually sought mental health support because of the impact of COVID on their day-to-day lives. So again, distressed teens, distressed parents. When we took a look at the relationship between strain and anxiety, we found it to be, significantly correlated. The higher the mother was, the greater the role, the caregiver burden was, the greater the burden, the greater the anxiety. And what predicted it mostly? Well, number of things. One, poor mental health, prior, having had prior mental health services. And what was really interesting, again, was that the moms who reported that their child's mental health had gotten worse was significantly related to the level of their own anxiety increasing and their own level of burden increasing. Younger moms also reported more burden, as did mothers with less less financial means. So, what were the takeaways from our surveys studies? So, when we looked at youth and young adults, significant number reported decline in their mental health, and a desire for, more future services, which for us raised the concern of a potential surge in demand for future services, and whether or not we'd be able to meet the demands would have tremendous implications for young people's well-being. What was also interesting is that the young people said they weren't just interested in seeing someone; they were also interested in other types of interventions, whether they be, just informational or peer support or online. On the parent side, nearly a third reported their mental health is poor, and roughly 15 had to receive support because of their mental health only since the pandemic. And their strain and anxiety was significantly related and significantly elevated. And again, caregiver strain, the burden was associated with increased children's mental health worsening during the pandemic. So if we pull all these findings together, what do we find? We started with a pretty highly distressed group of young people before the pandemic. Then we introduced the pandemic, so we even have a greater proportion of highly distressed youth. In addition to that, we now have highly distressed and overburdened group of parents. And we all know that prior to the pandemic, there was already an existing lack of services, both those that are publicly funded and privately funded. And then since the pandemic, we can only expect those things, those services to be even in more demand and potentially even more scarce. So the question is, what can we do? And what can we do, not just as professionals, but also what can we do as parents? And so one of the things that we always think about is, okay, what are the things that I can offer my child to help, her or him cope with their level of anxiety or stress or distress? So these are the typical individual, clinical interventions that people talked about. And I know that Dr. Gillespie probably talked a little bit about this for sure at the last talk, but just to go over it again, and maybe you'll find something new in tonight's presentation, or just reinforce some of those tools that you might have heard last week. So when you're looking at individual clinical interventions, there's really three major types. There are the psychological based interventions like cognitive behavioral therapy or CBT. There's other psychological interventions that you might have, that you probably heard of, like mindfulness, or DBT, which is dialectical behavioral therapy that's sometimes used with youth who have more serious, mental illness. There are psychopharmacological interventions, including the various SSRIs and SNRIs, like in Prozac or Faxer. And then finally, there's the combination of psychological and psychopharmacological intervention. So I'm going to walk through a couple of these interventions. And again, the idea being that potentially there may be one or two things that you might be able to use when you're with your own children. So in cognitive behavioral therapy, there's really three different things that we're interested in looking at. We're interested in looking at, feelings, thoughts, and behaviors, and all three are related. So how we feel affects how we think, affects what we do. What we do affects how we feel, affects how we think, and so on. But you can't change feelings. It's a really, really hard thing to do. So if someone's depressed and you tell them to cheer up, it won't work. If someone's anxious and you tell them there's nothing to worry about, it doesn't work. And so what we try to do is not try to change feelings. What we try to do is change thoughts and behaviors. And if we can change thinking and behavior, then potentially we can change feelings, because all three are interconnected. But what we do is educate, our young people on what anxiety is, what stress is. So those early slides, so that we try to normalize certain things. We try to get them to understand that how it's expressed physically, how it's expressed in terms of our interpersonal relationships and so on. And then what we try to do is we try to teach different behavioral interventions that might be helpful, and different cognitive interventions that might be helpful in terms of changing their feelings. So, for example, in behaviors, we'll talk about things, doing things like exercise. Exercise can be incredibly, powerful in terms of changing the way we feel. Listening to music, playing music, going for a walk. And then we go into, even other more in-depth sorts of behavioral techniques, like teaching them, breathing exercises. And then finally, we also focus on thoughts. And in thoughts, what we're trying to do is help our youth understand and become aware of negative thoughts and distortions. And I'll talk about those in a second, and try to develop alternative rational thoughts that can lead to more appropriate and healthy behaviors and feelings. So these are what I call the top 3 cognitive distortions. And I'm sure as we're going through these and you think about your own kids and what they'll tell you, and even yourself sometimes, you'll find that when we're anxious and we're stressed out, these cognitive distortions, these ways of thinking become pretty common. So the first one is filtering. And in filtering, what we tend to do is we only focus on the negative detail, and we filter out any of the positive details. So the child comes home and tells you how awful they did on their test. She'll say, like, I just bombed that test. And then as you ask a little bit more, you actually find out that really there might have been 1 or 2 questions that she really got wrong. And so what happens is, in filtering, her focus becomes only in that 1 or 2 questions, or only those 1 or 2 questions that got wrong, and she filtered out all the questions she got right. Right. So, and it's a common thing, with people, with any individual who's experiencing anxiety. You ask them about their day, and they'll kind of focus, they'll get wrapped up in what'll get stuck in their minds is that 1 or 2 things that went poorly versus all the other things that were just okay, and things that went well. And filtering then sometimes is connected to something we call polarized thinking, which is that very black and white thinking, and there's no gray. So they either get perfect, 90% or above, or it's a failure. So if they come home and they got an 86 on a test, they'll feel like I just did awful. I failed that test, and unable to sort of distinguish between, the gray, in day-to-day experiences. And so if you look at filtering and you look at polarized thinking, you put it together, what often will happen is something called overgeneralization. So they end up reaching a general conclusion based on a single event. So, I've heard this from my own daughter, who will come home and say, and she's finishing grade 12, and she'll come home and she'll say, oh, I just did awful on a test, and I just can't believe it. I'm going to bomb my subject. It's going to ruin my transcript. I'm never going to get into university. It's, what am I going to do? And usually accompanied by lots of tears, right? And then that leading to that catastrophic thinking, not getting into university. I'm going to, my life is ruined. And it all started off often with, never having gotten back the marks, by the way, never having gotten back the test. But again, the idea that remembering that she did 1 or 2 questions wrong, then going into the, oh my goodness, I didn't understand those questions. I know I did terrible. I failed that test, and on and on. So what we want to do is change we want to be able to be aware when our children are filtering, when they're using polarized thinking, when they are overgeneralization, and when they are using catastrophic thinking, to say, wait a second here. Let's talk about your test. How did you actually do? How many questions do you think you actually got right or wrong? And maybe, 86 is fine. Maybe 86 is still an A+, right, or an A. And that kind of leads me sometimes to, you know, the whole concept of mindfulness. And I really like mindfulness. And the one concept that I really get young people to think about is the wise mind. And I'm not sure if Dr. Gillespie talked about that, but I think it's a really it's a real interesting concept. So, you know, the first thing in mindfulness we'll talk a bit about is distress tolerance, the idea that you accept one's emotions, your thoughts and sensations, you try to stay in the moment, and you try to tolerate the way you're feeling. It's like the image of a wave. You know, the wave comes, you feel overwhelmed, and slowly the wave will subside and you'll feel better. But young people really resonate with the concept of the wise mind. So what is the wise mind? The wise mind takes the rational mind and the emotional mind and uses both that information to make a decision. So we know that our kids can get wrapped up in their emotions, their anxiety, their fears, and what we always end up telling them, so, you know, you don't think that way. You know, what about, you know, you got to think more rationally. You got to think about how to solve the problem. You got to think about how to do this and how to, you know, and how you could do it better, and what are the different strategies that you can use. So the parents end up always gravitating towards the reasonable mind. The youth gets stuck on the emotional mind. But what we want to do is really encourage our child to say, yeah, you know what, your emotions are really important. I know you're anxious, but you know, what about these other things? What about some of the other reasonable things, and using those together so that your wise mind makes a decision, not just your emotional mind. There are, you know, some young people that have pretty significant anxiety that sometimes will think about, you know, including you know, some sort of medication to help with the treatment of the anxiety, particularly if there are lots of physical symptoms, right? So tremendous sleep problems and lots of worrying and panic and sweatiness and just feeling overwhelmed. And this is a study, and it is you know, one of the most famous studies done by John March and John Walkup on the use of psychopharmacology in combination with psychological-based treatments to treat anxiety disorder. It was published in the New England Journal of Medicine in 2008. There have been a number of other studies, you know, since, but this was the first to really was a landmark study that showed how you can use both the CBT as well as meds to treat anxiety. So in this study, what they had was 488 children and youth between the ages of 7 to 17 diagnosed with either separation anxiety, a generalized anxiety disorder, or social anxiety disorder. And they were randomized into 3 different treatment arms. They either got a placebo, or they got medication. Or there's a placebo, medication, cognitive behavioral therapy, or the combination of cognitive behavioral therapy and medication. So the first thing you notice is that 24% of kids, whoops, I'm gonna go back there for a second. 24% of young people responded to placebo, which is a typical kind of, you know, effect that you'll find. 60% responded well and showed no anxiety after treatment using just CBT. 55% responded well using just medication, but the combination of CBT and medication resulted in an improvement in anxiety of approximately 81%. So again, in this highly clinical sample, the combination of the two showed the highest improvement. And sometimes that's the conversation we'll have with parents, and we'll encourage parents to have a discussion with their family physician about the use of medication. If the child's anxiety is so elevated that you can't even, you know, get, you know, to penetrate, to start working on some of the CBT strategies or the DBT strategies or the mindfulness strategies, you know, the medication just helps to certainly lower that, you know, their baseline level of anxiety. So then you can start doing the interventions, and the child learns, you know, the strategies, you know, to help them deal with their distress as well. So I'm going to pass it on now to Stacey to
Okay, I think we've got this figured out. I'm hoping people can hear me. And so really that's a great place to launch into that question of, is this enough, right? Really, we have lots of information, robust studies that have been conducted to talk about the individual options for treatment. We know that CBT works. We know CBT in combination with pharmacology can help as well. We know that there's lots of research about building distress tolerance skills and emotion regulation skills. And yet our girls in particular continue to really struggle with the elevation of anxiety, even pre-COVID. Now we can see that it's elevated even more so, and that we have the additional burden that's being placed on parents consequent to the pandemic that is causing a lot more challenge for families as a whole. And so really what I want to do with you is try and take a step back and zoom out, right? So right now we've sort of zoomed in, and Mary gave a great overview of what we're seeing with our girls, what we're seeing with our children and with our teens, as well as with parents. But we have to remember that we're all in a system together, and really we talk about the family as the system, and even more so when we zoom out farther, we have a greater community system. So I loved how at the very beginning James, was introducing this talk and talking about the children we love and care for at Elmwood. And that really speaks to that sense of community. So the importance of being able to zoom away from just focusing on the child to the family and then to the community abroad is especially important in our conversation tonight. So what else can we do? That's really the question we kind of come back to is there something that we're missing here that we can be doing? And this is really where we kind of talk about the impact that we're seeing on the parent-child relationship. We're hearing certainly clinically about a lot more conflict. We're hearing about sometimes the opposite of conflict, where there's a lot more need for proximity. We're hearing that kids are sometimes becoming more clingy, and that there's a lack of connection in some families, and sometimes it almost feels like too much connection in other families. And so much as we've talked about the impact on both children and parents, we need to really be looking at the whole family context. So this is where we're going to jump in a little bit more to attachment. And some of you might be more familiar with the concept of attachment theory than others. So we'll just give sort of a brief overview. And really, when we think about attachment, it's a biological based strategy for survival, right? When we think about our children when they were babies, if they were with you when they were babies or infants, their cries, an attempt for support and comfort, resulted in an adult hopefully providing that comfort and security for them. And that is really where we begin to see the formation of attachment. So it is a biologically based survival strategy. It's also our bond. It is our connection that we often feel when we talk about feeling a connection with our children. That is sort of the attachment piece. But really, again, we think back, and for those who might have taken Psychology 100 in university level, hopefully the name John Bowlby sounds familiar. And so, he was one of the founding fathers of attachment theory. And really, we think about, I think back right away to the study that he looked at toddlers and parents who were at a park, and he would see the toddlers sort of move away from the parents and go out into the world to explore. And usually one of two things happened. Either the toddler would get a little spooked and turn around and look for the parent and run back, or the parents would get a little spooked and run after the kids. But one of those two things was likely going to happen if there was a secure connection and attachment. And really, it's because this is how the attachment is made, and it's how children develop what we call an internal working model or a relationship roadmap, knowing how their needs are going to be met, that there will be somebody there to meet their needs, how they themselves are seen in their environment and their relationships. But really it speaks to sort of this idea or the concept of a safe haven and a secure base, which are really that is the foundation of attachment security. So safe haven being, this is the place where I can be returning to when things get scary, and the secure base is the place from which I can go out into the world knowing that I have the tools and ability to do so. So when we talk about what is attachment-based therapy, we're really talking about First of all, something that has a strong research foundation, right? There's a lot of studies that have been done both in normative and in clinical populations. It generates a lot of principles, so it's not so much prescriptive in terms of how to parent, but it's much more about therapeutic strategies that are applicable to parents and families and individuals. And it really gives meaning to perplexing or challenging behavior and can help to generate different options for treatment and support. So it's a model of understanding really personality development in the context of our close relationships. And really when we talk about our relationships in this context, is the parent-child relationship. It's a model of understanding emotion regulation in response to significant emotions like stress, anxiety, impulse, and rage. And of course, with some even more complex emotions that we would see as being like, for example, guilt and shame, which are especially challenging for a lot of children and youth to experience. And so modeling an understanding of how to cope with some of these big emotions, how to communicate effectively, how to have empathy, which is a skill. Sometimes people don't recognize it's a skill, but it is absolutely a skill, is particularly important in the development of these connections that our children have with us. And really, the attachment-based therapy model looks at the family as being the medicine. So I did want to talk a little bit because there are quite a number of models for attachment-based interventions. And so some of them that you might be more familiar with would be the dyadic developmental psychotherapy. Some people know it as PACE, which is Dan Hughes' work. So playfulness and acceptance and curiosity and empathy are all really important in the foundation of that approach. Some of you might be familiar with Circle of Security, or with more relationship-focused therapies like EFT, so emotionally focused therapy. That's often used in marital counseling, but certainly with families. And so there had been quite a lot of work that was done with young families, but not quite as much done with families with adolescent children or older children. And this is sort of where Connect comes in. And so Mario and I were both introduced to Connect through Marlene Moretti, who is sort of one of the founders of this program, or the founder of the program. So she is the she through Simon Fraser University and with work from the Maples Adolescent Center, developed in collaboration with parents and professionals and government stakeholders out in British Columbia, this Connect program, which is really an empirically supported attachment-based treatment program for parents of adolescents initially, although it's now been expanded for lots of different groups, including younger children and those who have experienced trauma, and for those who are fostering or in the adoption community. It's a 10-week manualized program that's facilitator-led and, as I said, attachment-based. It initially was developed for parents of adolescents with severe problem behavior, with severe mental health and or who've experienced criminality. And it's essentially based on 9 attachment principles. And I'm going to talk about not all 9 because we actually don't have time for that, but I'll talk about a few of the key ones this evening with you. Before we do that, though, I'm really hoping this is going to work easily for me. What I'm going to try and do is let you access this and then try and flip over to the screen to show you the results. But the question I have is, when you think of attachment needs, because that's a lot of what we're going to be discussing in the next few minutes together, what comes to mind? What do you think of as being an attachment need? What do our children need? What do we need from our attachment relationships? So I'd love for you to just take a moment, and you can go to PollEV, so PollEV.com/my name, STACEY SEGAL 022. There's also a texting option. I've not tried it, so I hope it works, but it's Stacey Segal 022. That you text to the numbers 37607. So it's up on the screen right now. I'll leave it there for a moment before switching over. If you are going to the web-based one, just skip the login altogether. You don't have to do that. You don't have to register for anything. You can just close that, and it should bring up a box that you can type in your thoughts on what an attachment need might look like or be. So I'll give you a moment to do that. And of course, there's a few little hints that you can see on the screen right now to help direct you to some of these ideas. So I'll give it just a moment. And then I'm going to flip over to the other screen. I can't tell from where I'm sharing from whether there's words popping up, but I'm an optimistic person, so. Okay, so I'm going to go over to that screen just because I am mindful of our time. There we go. Well done, parents. So we see quite a few things popping up here. The need for autonomy, the need to be included, the need for love and safety, for security and support. You guys are keen, I love it. Affection, understanding, the need for forgiveness, absolutely. The need for empathy and for belonging, to be heard, to express yourself. The need for boundaries. Yeah, these are great. Okay. So you guys are getting it. You know your stuff. Okay, so I'm gonna just, I'm sure there's lots more that can come in, but you've covered quite a bit of what we think of when we think about our attachment needs. And really I'm looking at this screen and there's still lots more coming in, and I really appreciate your participation. You all get an A. So when I think about these attachment needs, and I'll just sort of flip back over to where we were before. Hopefully we're back and everybody can see that. So really what we're talking about is, this balance actually, right? When we looked at that category, those categories of words, they really fall into sort of two different columns. And this is where we kind of introduce the attachment coin, we call it, right? It's really two sides of the same coin. It is the need for both connection and for independence, for autonomy, to be heard, to feel important, to feel valued, to have our own path, to form new relationships, but to feel safe, to feel secure, right? To have, some boundaries. When somebody wrote that out, absolutely, right? And so these are the things that sometimes allow us to feel connected. But it's a tough balancing act for a lot of families, especially as our teens are getting older and we think about how they express these needs. And the reality is that over the lifespan, we all have these same needs. Those needs don't change. Those attachment needs don't change at any point. But how they're expressed and how we address those needs may shift over time, especially in our role as parents. And it can be particularly challenging to balance these needs as our kids get older, because suddenly it's not about running beside them when they're learning how to ride a bike where they want your support. It's about them saying me, myself, and wanting to be able to do it independently and alone. And that's really scary for many parents. I know it scares me. I've got, two teens and a preteen, and it can be quite frightening to let them out into the world and to try and let them do it on their own, especially because they really do still need us. And so often, we actually can feel like, that they don't need us at all, and they really just want us to step aside. And the truth is that, if we can find a way to step back and think about what it is that our teens are actually expressing to us, what they actually need, then we can leave the door open for better communication and a better relationship. And so we have to try and find a way to communicate that we're actually on the same page, that their safety is important, but so is their independence. So how we communicate that, we're going to come back to, but it is important to think about the fact that there are going to be developing additional attachment relationships, and sometimes that goes beyond us. Often, in fact, it does, and it usually starts earlier than the teen years. But certainly, we recognize that in those adolescent years, adolescent years, that those other social relationships actually become really, really important. And it makes me think sometimes of, I used to have this old Winnie the Pooh book that you'd press buttons and they would sing songs for my kids. And I remember one of them was probably a poem that didn't come from Winnie the Pooh, but in any event, maybe somebody here knows it. It's the make new friends, but keep the old. One is silver and the other is gold. And, it's important to recognize that even though you may not always feel like you're the gold one, you are as a parent, and our kids do need us, and we remain the constant relationship over the lifespan. From cradle to grave, the attachment stays the way it is, right? That we remain an important part of their building blocks as young people and into their adult world. So certainly feeling replaced is something I think a lot of parents might experience, but really important to recognize that it's not a replacement, but rather they are adding new relationships. So when we also think about what they're experiencing right now, which is unique to the pandemic time, you know, we're going to come back to that, but it is quite a lot of loss that we're thinking about. We have to take a moment though and recognize that how we express our needs changes as well, right? So all behavior has meaning is one of our principles in attachment, and you know, understanding that attachment is a basic human need that shapes behavior, right? The way we behave has meaning. We have folks that are more internalizers, and we see folks that are more externalizers. And Mary spoke to that earlier when we talked about all the different ways that anxiety can manifest. And so it's not uncommon for me in any given session to hear about both types of behaviors, right? Kids who have more somatic complaints, kids who are more withdrawn, kids who are up in the rooms with the closed door, as well as the kids who are slamming the door, right? So what do those behaviors mean? And that's a lot of the guessing game that we often have. Even though we when our babies were small or kids are little and they cry, we're sort of prepared to guess quite a lot. As soon as our kids develop language, suddenly we have this expectation that they're just going to communicate very effectively what they need and how they feel. And it's just not that simple. And frankly, as adults, we don't always do that all the time either, do we? So really trying to understand what those slam doors or moments of isolation mean is part of the new type of guessing game we're playing with our kids. And, oh, hold on, my screen just is not cooperating right this moment. So, oh, sorry guys, not sure what's happening here. I'm just going to get rid of that and make sure that we're still on this page here. We're still on our PowerPoint. Okay, good. Okay, so back to where we talk about sort of some of the things we're seeing right now and the meaning. And I think this is really important. And this is often the conversation I have with parents, you know, and part of this you might have already been seeing and hearing about and witnessing yourself, both as adults in the world we're living in, but also through our kids, through the lens of our kids. And that is really a lot of loss. We have loss of connection with others. We have loss of our sense of security and safety in a pandemic. It's not a false alarm. This is the real deal. Loss of direction and feeling like we've lost some of our activities, and that often brings us meaning. You know, lots of kids who are in competitive sports, for example, or like to do, you know, my kids really enjoyed doing musical theater, and that's not happening right now. So there's a lot of loss of identity that they might be going through, where this was their thing and now they can't do their thing. There's a loss of, you know, independence that a lot of teens are wanting to go out into the world and go to malls and go to movie theaters and hang out with their friends that they just can't maybe do the same way they were able to pre-pandemic. And that can create a lot of feelings of loss of hope. And of course, that results in a loss of happiness. So keeping all of these things in mind when we see some of these really challenging behaviors, I go back to that slam door, when we can think about all these losses that our kids have experienced, it doesn't mean we have to condone the slam door. It's not about accepting behavior that's unacceptable, but it can often lead us to take that step back for a moment and think about the meaning and provide us with more opportunity in terms of what we do next. So I want to go back for a moment to how our kids express their attachment needs. And, you know, I'm often referring to this book that Sandra Boynton wrote. I was a big fan of hers when my kids were young. And this one is What's Wrong, Little Pookie? And the reason I like to reference it is because I feel like it is a handbook to parenting. This is parenting in essence. And really the whole book, if you're not familiar, is, this little piggy named Pookie who is crying, and his mummy comes up and says, "What's wrong, little Pookie?" And Pookie doesn't answer. And mummy has to guess, are you hurt? No. Are you tired? No. Are you hungry? No. And she goes through the whole gamut and everything you can possibly think of, and is completely exasperated and desperate because she just wants Pookie to feel better. And she finally pleads with him, "Please, Pookie, just tell me what's wrong so I can make it better." And Pookie says, "I don't remember." And it really, really kind of resonates with me, both as a parent and as a clinician, because this is sort of what we do from the time our children are small, even through their teenage years. It's a bit of a guessing game. It's trying to crack the code of what is behind the behavior, what is actually happening right now, what is the meaning for our kids. And so not only are they not necessarily communicating in verbal ways, but we sometimes are responding or communicating with them in nonverbal ways. And that matters too. It's not just what we say to each other, but how we say it, right? Our nonverbal, our facial expression, our body language, our paraverbal, our tone, our volume, right? Our pitch and our speed matters. It makes a difference in how we are understood, and it makes a difference in how we understand others. So being able to pause and step back to try and understand both what we're projecting to them, but also try and understand what the meaning is behind those behaviors, that allows us the opportunity to find new ways to connect with our kids. But a lot of the time, certainly the conflict, or what we hear about when it comes to behavior, is really conflict, right? So defiant behavior. Sometimes it can be sort of we call them the teenage meltdowns or tantrums, and we're really talking about how conflict plays a role in families, because the reality is that while it may not be the most pleasurable way to communicate, conflict is absolutely a form of communication, and it tells us there's something happening. Right? There's something going on that needs to be problem solved or communicated differently, for sure. But it is something where when it's expressed and managed in a constructive way, and when we look for opportunities to repair, it can offer new ways to understand and connect with each other and to grow from those experiences. So thinking about walking that middle path, as Mario mentioned before, between the emotional and the logical, it takes a lot of practice. So even as adults, we have to be recognizing that it is difficult for us to take that step back. It is incredibly difficult for us to be able to hit the pause on our own emotions, and yet we are role models to our children. So being able to hit the pause button and think about where we're at, and then to try and step into our children's shoes. Again, not to condone or accept behavior that's unacceptable, but to try and understand the meaning behind the behavior can allow us to find different ways of connecting with our kids and different ways of responding that can be a lot more positive. So one of the easiest points to remember, I think, when I talk about conflict, is this idea of connect before correct. Right? We are often quick to react, but being able to pause and meet our kids where they're at on that emotional level, right? So the slam door may result typically in a, "Why did you slam the door?" And if for a moment we can pause and step back and recognize that there's some really strong feelings happening, and try to figure out what those are about, or maybe we think we know already what they're about, then stepping into that room and addressing those emotions first, and recognizing those emotions before correcting the behavior, can sometimes disarm our teens and allow them to communicate more effectively with us by feeling empathy and understood. And so empathy really is the heartbeat of attachment. It's our go-to, right? We come back to this each time. And understanding that while absolutely it can be a lesson in frustration in trying to communicate with our kids and with our teens in particular, and unlike when they were small and they wanted solutions to their problems, usually in the growing years and pre and post adolescence, or during our adolescence and even into adult life, sometimes people just want to be heard. They just want a listening ear. They don't want you to fix it. They want you to understand, and they want to know that you care. So when in doubt, it is zipping the lips and opening the ears as much as we possibly can. and letting kids understand that while we may not completely agree with their decisions or their thoughts or ideas, again, it's not about reinforcing, for example, cognitive distortions that Mary would have talked about when he was discussing CBT or cognitive behavior therapy. It is very much about trying to first listen and understand and validate the valid. And really that comes back to the emotions. Validating emotions does not mean we validate behaviors, and it doesn't mean that we validate thoughts necessarily, but we can definitely let our kids know that we understand. So often when I'm teaching this to kids, I call it reflective listening, right? The idea of listening to understand rather than listening to respond. And it's a difficult practice to switch from what was being the fixer to now being the listener. So I often say to kids and adults alike, practice makes better. And the other thing that we, of course, need to pay attention to, and Mary had brought this up in the previous slides and in the study that was conducted, is that parents are struggling too, and that we absolutely feed off of each other, right? We are not in little bubbles, but rather in a bubble altogether, right? And so recognizing that it is incredibly important for adults to have their own adult support, that our kids cannot be our support. That's not their role. And that doesn't mean that it doesn't change and shift over time. It absolutely does. And we try and balance our needs with the needs of others. And we want our children to learn to do the same thing. But the reality is that they're not at a place yet in their development where they really see us as being our own people. They're learning, but they may not quite be there. We're still there to meet their needs. And so much as we can at times see that they're capable of meeting our needs, that they want to meet our needs, we know that really on the balance, it's kids' needs are here and parents' needs are kind of down here. So recognizing all of this, and that absolutely, it is important to negotiate and look for that balance and teach our kids how to balance their needs with the needs of others and model empathy and teach them to be thoughtful of other people, they will absolutely turn to us at the end of the day to meet their needs more than anything else. And so really, trying to ensure that we have our own adult support is going to help alleviate some of the stress that we sometimes find in the parent-child dynamic. So change ahead. This is the big warning sign. It's that, old, cartoon of who wants change, and everybody raises their hand, and then someone says, who wants to change, and everybody lowers their hand, because change is difficult and change is scary. And we know that both developmentally and when it comes to mental health diagnoses and the onset of a lot of mental health issues, that when we think about sort of latency age kids or the preteens and the teenage years, there's a lot of rapid growth and change that's happening. And while at times our kids are very capable of managing a lot of these changes and a lot of these difficult situations, they're still growing. And we know that brain development doesn't stop when the teenage years end either. It goes well into the 20s. So really, considering how our children meet these developmental milestones and recognizing that there's going to be both joy and pain as our children go through this growing process, that it can be quite scary. Like we talked about before, it's not just about riding a bike anymore. It's going out and having other relationships and romantic relationships and going to university and all the things that come over the next bunch of years. Can be scary, not just for the teens, but for the parents and vice versa. So part of what we try and do is hold on to this idea that growth and change, can be both celebrated and it can be scary. And so moving forward while understanding our past experiences is a big piece of how we help our kids to grow. And so it's important, though, also to recognize that they are growing and that they're not who they once were. And sometimes we default to previous behaviors, to different styles of communication. And so it is incredibly important, and I often will talk about the proverbial sock on the floor. It is incredibly important to recognize its absence, not just when it's there. I use sock on the floor because that seems to be the thing in my house, although maybe it's shifting to bowls and plates now, but it's not supposed to be there idea, right? And noticing that when it's not there, we need to also notice that. We need to notice our children when they're growing and changing and evolving and recognizing the people that they're becoming, but also recognizing that we as parents are growing and evolving too. We have to. They change, we change. It's like a rocking boat, right? Somebody stands up, the other has to readjust, or we both fall out. So it really is a constant shifting and changing and rebalancing in our relationship with our kids. And of course, right now we are in a significant time of change, right? Things continue to change and evolve, and there's a lot of instability, which can be quite frightening. So taking advantages whenever we can to recognize what is the same, to celebrate the growth and changes that we are seeing, to acknowledge the efforts of our kids, and to provide that praise whenever possible, allows us to feel a kind of connection with them, and for them to feel a support and connection with us that will help us to get through times of adversity. And we are certainly in those times right now. So really, just to do a quick summary of these attachment principles we've talked about tonight, it really is that, attachment includes a need for connection and also that need for independence. And that while all behavior has meaning, we don't always know which one it is that they're meaning to show us, right? Is that need for connection or independence? And sometimes it's that little pooky question and trying to figure it out. But stepping back and trying to understand the meaning is what's really important. It's not about cracking the code. It's not on the changing combination, by the way. It changes every other day, it seems. But it really is about the effort in trying to understand. And stepping into their shoes can help us to respond better to their attachment needs, even if we get it wrong. Just the point of trying to understand is meaningful for them and for your relationship. It's also important to remember that conflict is a form of communication and can be an opportunity for growth. And really, most importantly, when we talk about conflict, is about the opportunity to repair and what we learn about each other and about the experience through that conflict. It's also important to remember that our relationship changes over time and our needs change over time, but the need for connection and for independence, those two sides of that same coin, remain consistent. That does not change. Our need for attachment stays with us over our lifespan. Balancing our needs with the needs of others is a skill that requires modeling and empathy and flexibility. And finding meaningful ways to connect, both planned and unplanned, can be a part of our everyday lives. So it might be just offering to get someone lunch. I did that today. One of my kids was in a high school virtual thing and sent her a text message and said, "Do you need lunch?" And she said, "Yes, please, if you can." Just that gesture, bringing her something, reinforces the care and support, and that her needs are important and that she can count on me. And so now we come back to some of the pieces that I put out there, but a little more solidified for you as a takeaway. And these are really, you can see, I know Mario doesn't love the ear in the heart, but that's okay, because it really does kind of, for me, speak to what we're talking about when we say empathy. So the idea would be to take a step back, try not to react, pause for a moment, consider your own emotions, and then when we can, we want to step into our kids' shoes to try and understand the meaning behind their behavior. We want to be able to show them empathy and understanding, and that's not just through our words, it's through our actions, it's how we behave, it's our mannerisms, right? It's putting our cell phones down and giving them undeserved attention that they require, right? Or uninterrupted attention, rather, that they require, and being able to give them the eye contact and the support they need. It's connecting really first before the correcting, which might be the intervention part. We intervene when we need to, absolutely. And it's, again, not about accepting or condoning difficult behavior or poor choices, but first about connecting before we correct. We can use some of the CBT techniques that Dr. Cappelli talked about. We certainly will talk about cognitive restructuring, use of mindfulness techniques that we talked about with DBT. And there are many other ways to support our kids just in terms of managing their own stress. And looking for opportunities to notice and reinforce the growth and change that we see in our kids is the last piece, noticing the absence of the sock. So hopefully these are some things that we can keep in mind moving forward that will help to strengthen the connection, the attachment bonds that we already have with our children to get them through these challenging times, and can be helpful to ourselves as well in these challenging times. So just as a quick summary, we've got some very stressed and anxious kids right now. When we add in a pandemic for what we already saw was a very stressful and anxious period of time for our children, and we add in our own parent stress, we realize that we have a lot more challenge. There's a lot more behaviors that we see that are challenging for us, a lot more conflict we're seeing in families, and a lot more need for support. And while there's lots of individual options for managing our mental health or our teens' mental health or our children's mental health, including pharmacology, CBT, DBT, and counseling options that go with all of those, really we come back to what will be long lasting is our attachment, our connection, and how we communicate with our kids to support them through these times. It is that relationship that stays constant, and that's where we want to turn to, so that when we are in times of adversity, we need to trust in our relationships and in our bonds. So I'm going to now flip it over and to our question discussion period, and want to thank everybody. I'm sorry that we ran a little long. We had a lot to cover tonight, and thanks so much to Elmwood for hosting this session today.
Thank you so much, Dr. Cappelli and Dr. Segal. This has been an incredible session. I've been jotting down notes the whole time and capturing some of the information, which was just such a wealth of, you went from the research to kind of breaking it down for us for our understanding, and then giving the practical strategies and techniques as well. So it's really given us a really full picture of what our girls might be experiencing, but also kind of how it could be impacting us too. So I think it was extremely helpful to have your expertise and have you share that with us this evening. We do have some questions that I'm going to help to moderate in the chat. So one of the questions is around kind of helping the girls to manage these feelings. And the idea of attachment, I think, is really connected to this. Because of the pandemic, there are options for staying and learning at home or being in school. And of course, with some of the attachment and those attachment behaviors, it's maybe that the girls are expressing a desire to just stay at home because it feels safe, it feels more comfortable. And the question is around, when would you encourage them to come into school? Do you have any strategies or tips on how to measure that kind of balance between allowing them to stay and learn at home or coming into the school building?
So I don't know, Mary, do you want to speak to that, or do you want me to speak to it?
I don't mind starting, and then feel free to jump in too, Stacey. I think, the idea of virtual only learning was really a public health measure because of the risks associated with the potential, virus and becoming infected with the virus. It is probably, in our view, an incredibly unfortunate intervention. What happens is that, and not sure if you remember the one slide where I talked a bit about the different ways anxiety is expressed. The very last one was in avoidance. So often what happens, and it doesn't matter if you're an adult, if you're a child, you're a teen, when we're anxious, when we're afraid of something, we avoid. And the whole avoiding actually reinforces feeling good because we're no longer anxious, and therefore we will continue to avoid. And by avoiding, we then will not want to do the thing that's going to make us, feel anxious, go to school. So, a lot of the kids are now, are kind of stuck, right? Because when the parents are stuck, because they want to see their kids re-engaging, they think they can re-engage, but the kids are saying, "I'm out. No way am I doing this." And at the same time, they're still allowed to do full-time virtual schooling. So, they can argue that why do I need to go back? Right? So the way you would normally treat something like that And it doesn't matter if it's just virtual learning or any intervention when it comes to anxiety is through what we call exposure and through small exposure. So the idea is that you don't want to put the child in a situation where you are going from purely homeschool to back in school, because we've created the situation for them where it's allowed them to escape that anxiety. So we want some slow reintegration back to school. Say, okay, that's it. You know what? We're going to start going 1 day a week. You're going to check in with your teachers. You're going to check in with some, and then 2 days and so on. So I think we're going to have to be a little bit understanding and patient with that reintegration back to school, for those kids. And I think, it's not just an anxiety, piece. It kind of goes back to what Stacey was talking about earlier. And I'm going to get her to sort of jump in and talk a little bit about, the whole idea of the meaning behind the behavior and what it means, as an attachment need for that child to hunker down and say, no, this is what I want.
Yeah.
If you want to.
Sure. And so, and I was just going to say that certainly when I think about how children are, expressing themselves, and there's been, a lot of the kids, when I think back to sort of some of the kids who we see as being sort of more internalizers and withdrawing and having a lot of, tearful moments and escaping a lot of the stressful things. We also equally would have as many kids who are very reactive and angry, and it comes out as anger and this need to sort of be in control of the situation. But in both cases, it really is sort of that loss, right? We think again about all that has been lost. And so, a lot of what we can see in these behaviors is perhaps actually genuinely being anxious about returning. It may also be a push for control. I'd like to be able to control something right now, and there's so very little that I can control. So this is where, again, being able to recognize, and we go back to this idea that at the end of the day, this is it's important that parents feel like they can make these decisions, right? That they can say, this is really important that you're in school. We feel it's a safe decision, or we don't, and you have to stay home. But whatever the decision is, parents being able to hear their children, let them know that they understand, let them know that they understand the emotions, and that we're going to support them through whatever the parental decisions are. And it's not because it's not important how they feel, but it's because we as the adults want to try and support their best interest, right? So it really goes back to that empathy piece.
That makes perfect sense. It's so clear when you explain it. So thank you so much. I hope that the answer was helpful for the participant who posted it. I do have another one about the attachment shaping behavior and the need to understand what is behind the behavior. So if we're struggling to understand, do you have any suggestions for leading questions or other techniques to try to really understand, like, what is going on behind the behavior?
Yeah, so I would say that a lot of what we try and do, and I kind of go back to one of the points I made near the end, which is we really need to listen more than we talk. We typically lose our kids, especially as they get older, after about 5 words. And, if they feel like it's an inquisition and that we are just grilling them, like, is it this? Is it this? I mean, they're not little Pookie anymore, right? So I think sometimes we have to be able to sit back and just sit with those emotions. And that's a really difficult thing to do as a parent. It's really tough. I've got 3 daughters, and it's thankfully most of them are happy to talk, but not always, right? And so being able to sit and just be patient and just be present is really important too. To give them time to talk. Silence can be our friend, even though it can feel uncomfortable for everybody involved. And frankly, it's often more uncomfortable for teens. And, I know I use this a lot in my practice. I think Mario probably does too, where sometimes we just sit and we wait, because at some point they're going to crack. At some point, they're not going to want to have that silence, that awkward silence, and they're going to say something. And that can sometimes lead us, right? But really just being present with them is giving them that message. And that's why, again, it's not always about the verbal. The nonverbal is equally important. Right? Letting them know that we care.
The waiting doesn't always work. I should just, sometimes it does. But I remember working on, I was the inpatient psychologist on the psychiatry ward at CHEO, and every morning we would bring all our teens together to do group therapy. And the whole idea was that they would have to sit and talk. And And I guess someone started saying, well, we're not going to talk. And so we would spend a whole hour in silence, right? And the kids would just not talk. And then the next day they didn't talk, and they also wore sunglasses, you know. And at one point we said, okay, enough is enough, right? You know, we got to talk about this. But I think you know, the one thing that sometimes, you know, you got to understand, I think there's two things. One is understanding what the, you know, emotional needs of the child are depending on where they're at developmentally. So there's going to be different needs for, you know, the kids that are 8 or 9 compared to our kids that are 16, 17. But the other thing is for the kids to understand that we don't know. It's kind of like this, you know, the probing of the question is really an indirect way of saying we don't really know what's going on. Therefore, we keep asking these questions versus just simply saying to them, like, you know, I'm sorry that I don't understand what's happening in your life right now. You know, I'm here, you know, I love you. And when you're ready to talk about it, you know, we can talk about it. Till then, you know, I'm going to respect your privacy and just know that my door is always open. And you leave it at that. And you allow them the autonomy and the control to then take the initiative versus us, you know, being on top of them. So.
Yeah, that makes a lot of sense. Thank you. I have another question here, and it relates to the information you shared about the correlation between the parents' feelings and the youth's anxiety. So some of that research. And I guess any advice on, I'm going to kind of two-prong the question. One, in terms of, you know, how helpful or not is it to kind of talk about personal examples? Oh, well, when I was your age, or, oh, well, you know, this happened to me today. Like, is that at all helpful for kids? Do they hear that? Or is it something that is actually not? And also, is it helpful to share about the anxiety we're feeling as parents? Or is that, you know, is that kind of then overburdening the children to share on that level?
So I think, you know, there's a couple of things. One is the balance that Stacey showed, you know, in terms of how we're balancing our needs. And so I guess from our perspective, from an attachment perspective, you know, we have to ensure that our needs are being met, but we balance our needs through the support of other adults. So the idea is that we don't look for our kids, for them to understand what we're experiencing. So as a way of connecting with them, so they will feel that they can understand how they're feeling, right? That's not the way we would look at it. So I think in many ways we it's not about that. And it doesn't necessarily mean that we can't share what's going on with our kids, right? It's not to say, you know what, sorry, I just haven't been available today. It's been a really crazy day. I've had work to deal with, and things hadn't gone well with some other stuff. And I'm really sorry. I'm just not here for you today. But I'm just tapped out, right? And it's amazing how kids are understanding, right? They get that. The problem is when the anxiety is overwhelming and it's constant. That's when it becomes a lot more challenging, because then the kids are then feeling like they got to help the parent, and that is not, the balance is gone then, right? That's not what this is about, right? The balance is always balance your needs, talk to your friends, talk to your therapist, but don't talk, it's not about asking your kids to support, right? And I don't think we do. I think it just, and then some of our kids are so like their antennas are up all the time, and are you okay? Are you okay? I get that all the time, right? Oh, Dad, you must have had a hard day today. Is there anything you want to talk about? Are you okay? And I say, oh yeah, I'm fine, right? And you just move on, right?
And I think the other piece is that sometimes we want to be able to role model too, right? So there's definitely been days where, I come up, from my basement office and I've had one of those days and it's a zinger, and the kids will see that, and I will know that they're going to feel that because I recognize my own emotions, right? So being able to model and say to our kids, it's been a rough one. I'm going for a walk, right? I'm going to do some self-care, and I'm going to come back to you like as your mom, because I need to do that for me. That allows them to see that we have skills that they can do without necessarily saying when I was a teen, which isn't a bad thing. We want to be able to share, but it's not always well received, right? It's like, well, you don't really get it. You don't know what it's like to be me, right? And so being able to instead kind of be with where we're at now as their parent, right? As their parent. So here's what I'm going to do for me, for self-care. I'm going to go call a friend. I'm going to go call my mom because I miss her and I just want to talk to her. Right? And I'm okay, but I just need a few minutes. Allows them to know that we all have emotions. We are actual human beings as their parents, right? And we have emotions too. And we want to try and make sure that we're okay so that we can be there for them.
Although, Stacey, I'm not sure if you're one of those parents out for a walk, or Megan or anyone else, but you know, sometimes when I'm walking and it's like 4 o'clock in the afternoon or 5 o'clock in the afternoon, I have a little bit of a break, and I see everyone with those thermos, you know, coffee cups that you have in the morning. And I wonder, like, okay, is that really a tea in there, or are they, what's really in that cup, right? Because, you know, just remembering, you know, that slide about parents and adults, you know, how overwhelmed everyone is, right? And not to make fun of it, because we know that, you know, that there's a real concern there in terms of the amount of substance and alcohol use. But boy, oh boy, you know, I sometimes, you know, I sometimes do wonder that, you know.
Right. And that's it.
So
And
Stacey, you're with the T, right, Stacey?
I'm just power walking. That's the truth.
Okay,
I'm
good.
just power walking. Yeah. So, and again, I think being able to role model, like you said, we want to have these healthy behaviors, and certainly a glass of wine at the end of the day for a lot of people is the norm and acceptable and manageable. But again, looking for those adaptive coping strategies, because our kids need that. They need to, you know, it's so much more important for them to see us doing it than for us to tell them what to do.
Mm-hmm. Mm-hmm. Yeah, that's really helpful. Just like everything that you've shared this evening, so practical and on point with things I think that we can all start implementing right away. In fact, I really have to go because I've got some kids upstairs that I really want to go talk to now. No, I'm just kidding. No, it's just been a pleasure to spend time with you this evening. And on behalf of the whole Elmwood community, I want to thank you deeply for sharing your expertise with us and giving us, you know, really accessible, practical ideas, as well as some of the more higher level thinking and research that's going on in this field. We do hear a lot about it as parents, as educators, and kind of helping to break that down and feel that, you know, it is, we can kind of unpack some of this, and there are things that we can do as a school, as teachers, as educators, as parents. And I think, I know that I feel as part of the Elmwood community that when we're all working together, we're going to have a much better chance of success in supporting these girls. And so thank you for being part of that this evening. I also want to say thank you to all the parents who have joined us this evening. I don't know if you guys can see it, but we're getting lots of positive feedback in the chat. Thanking you for your time. And I know we're going to be able to share the slides as well through our school platform. And so I'm just going to turn it over to Jennifer Irwin-Jackson to also wrap up the evening and let parents know about our next speaker series session. So I'm so excited. We've had 2 really successful evenings, and Jennifer can let us know about the next one coming up. So thank you so much again, both of you. Really appreciate everything.
Yeah, that was a terrific talk. Thank you so much. For Elmwood parents, we actually are going to have we have a bit of an impromptu discussion that we've organized for 9 o'clock on Friday morning for us all to get together. And we're going to do a bit of a book club following this conversation and have a little talk amongst parents about some of our insights and share some of our experiences. The next event that we have coming up is on January 19th. And that will be a whole school event, and it is author Rachel Simmons who will be speaking about a book that she wrote last fall called Enough as She Is, which is about the culture of sort of the pressure that girls are putting on themselves to be successful and how that's impacting them. So you'll be seeing some information about that coming out shortly. But thank you so much, Dr. Cappelli.